It really is imperative to know how to work well in a collaborative team to be an excellent public health professional today. Working in teams is a part of most professional work, and I have worked collaboratively as an educator and now at the Department of the Treasury. In both jobs, have required me to work in a collaborative team. Working in a collaborative team requires many competencies and skills and truly enhances the work that we perform. Teams are important places of learning in today's health organizations and are necessary due to the increased incidence of chronic disease, increased complexity of health issues, the need to link across practices, and the emergence of new models of care and interventions. From a professional development standpoint, learning best happens within context where interaction and active learning occurs. From a socio-cultural perspective, working in collaborative groups fosters teamwork and enhances knowledge and practice among professionals. All of this increases patient outcomes. In collaborative learning processes in the context of a public health professional development program, a case study, the Health Promotion Laboratory of Canada was charged with exploring a public health issue, understanding it, and developing a new intervention. For the teams that had an inclusive culture and an experienced leader leading the collaborative groups, they benefited from the collaboration. For the groups that didn't feel as comfortable to share due to work culture and poorer leadership, those did not have as much benefits. Collaboration is a beneficial team approach when the culture is accepting and inclusive, and this benefits communities and individuals. In my own experience, I have learned much from my collaborative teams. Some teams I felt more able to share my ideas more readily than others. It was beneficial to research and know how to make teams members comfortable enough to share their perspectives and strengths in collaborative groups. One of the things I've learned through this research is that managers should be cognizant of their management style and how their style affects their employees. Many employees suffer from workplace stress, and the manager is in a position to decrease this stress by the way they interact with employees. In addition, employees should be aware of the way in which they interact with each other and consider ways to decrease stress and building relationships with their colleagues so as to increase productivity as a team and to work collaboratively for the benefit of the others, themselves, and the community. Recently, I listened to a podcast that talked about exclusion at the workplace and how this really affects others emotionally and socially, causing them stress and pain. It's just reminded me of how to be inclusive and always be mindful of not forming groups and including others as a team in the workplace. This all affects one another individually and our outcomes for the community and the people we serve. So this is a real important skill and competency to have as public health professionals, how to work collaboratively, how to be mindful to others on our team, and to definitely be inclusive.